The Executive Director of Advocacy for Women with Disabilities Initiatives, AWWDI, Patience Dickson-Ogolo, has called on all relevant authorities to provide good health care services for women and girls with disabilities by keying into the United Nations Convention on Sexual and Reproductive Health Care for Women and Girls with Disabilities. Patience Dickson-Ogolo made the call in Abuja at a one-day awareness on sexual and reproductive health rights and inclusion of women with disabilities, as most times women and girls with disabilities are often neglected by health workers, which deny them having access to good healthcare services through attitudinal behavior. She noted that relevant authorities should wake up and be proactive to put an end to challenges faced by girls and women when it has to do with their sexual health and reproductive health services.
Challenge around access. For example, I'm a woman on a wheelchair. It is not easy for me to access buildings that have to do for me to go and get knowledge around sexual reproductive health. So that is one challenge. And then another challenge is challenge that has to do with the system. So within the system, for example, in the health facilities, we don't have sign language interpreters inbuilt. So we have to, instead of our women, we have to go with their own sign language interpreter or with family members who can sign to them, or we have to do a kind of traditional writing method, which is not really so okay. So these are some of the challenges that we have to go through. And another big challenge is the attitude of health workers. The health workers look at women with disabilities as not women enough to have those challenges with sexual reproductive health rights. So these are some of the challenges that we want to bring out so that people see them and know that they are indeed challenges that have to do with the women with disability because they are women and because they are women with disability. My call is very simple. It's just to recognize that the UNCRPD, United Nations Convention on the Rights of Persons with Disability, that Nigeria signed into, have a provision for health components. And that health component also speaks to issues of sexual reproductive health and rights.
Representative of the government agencies who are saddled with responsibilities of advocating for rights of women and girls with disabilities present at the event advised all women and girls with disabilities not to keep sealed lips when faced with challenges that has to do with trampling on their rights.
In my office, apart from the disability office, we have a gender-based unit. We have so many cases of sexual, reproductive, and domestic violence between husband and wife that they are disability persons. Yeah, we have so many cases, and we have been telling people to speak up because we discover that as you get to know that they have this kind of case and you are trying to mediate, the wife will even tell you not to bother any longer. It's my husband. We are still doing our best to make sure that they should speak up so that we can help them and get justice for them.
In an agency that handles, that deals with trafficking in persons and violence against persons, we have issues that most times has to do with persons with disability. So the message we are coming is just also for us to come and encourage them and show them that we also put them in our programs, that we have this disability inclusion policy in our agency, which takes care and looks into the needs and the demands of persons with disability, especially when it concerns issues that has to do with trafficking in persons and violence against persons. So those are the contributory aspects of it that we're going to.
Access to good healthcare services is the right of every woman and girl with disabilities. Hence, everyone should be available to lend a helping hand to them when the need arises.